Hi, my name is Dave. I'm one of the advanced practice physiotherapists here at the Orthopedic Joint Assessment Center at Markham Stouffville Hospital, and today we're going to be running through your post-operative ACL reconstruction physiotherapy for the first 7 days. Depending on who your surgeon is going to be for your upcoming ACL surgery, there is going to be different protocols that you're going to be following based off their discretion. So each of you will have received a handout in regards to your particular surgeon's protocols, and they will discuss things such as your weight-bearing status, whether or not you'll be needing to use crutches, as well as whether or not you'll require a splint following your surgery. All the exercises that follow, they are going to be started on the day of your surgery as instructed in this educational video, and you're going to be doing these exercises until your first post-operative physiotherapy appointment that should be arranged approximately 5 to 7 days following your surgery. It's important to remember that please only do these exercises during this time frame. First step is going to be reducing swelling. So what we would like you to do is you're going to be elevating your operated leg as much as possible. It doesn't need to be particularly high, just about 2 feet above your heart when you're lying flat. The important thing to remember is you're not going to be placing a pillow underneath your knee that keeps you in a bent position. Following surgery, your knee is going to want to maintain whatever position you keep it in for the longest period of time. So we want you to try and keep it as flat as possible, except when you're doing your exercises. Now, when you're icing, you're obviously going to need to remove your tensor bandage or the Zimmer splint that's on, depending on what your surgeon's preference is. And you're going to be trying to ice it in the first little while every 2 hours in 10 to 15 minute intervals. And for the first 48 hours, you want to maintain that procedure. After those 48 hours, we still like you to ice following your exercises, as well as trying to maintain at least 3 to 4 times daily. Your exercise program to start with is going to consist of 3 exercises. They are designed to start early on rehabilitation, and these are to start immediately after you wake up from surgery. So to start with, it is important to remember that you do need to remove your Zimmer splint or your tensor bandage before you can perform your exercises, but you will need to reapply them afterwards. Okay, so for your first exercise, what you're going to be doing is what we call ankle pumping, and you're going to be pointing your toes down as far as you can and bringing them back up nice and slowly, and you're going to be repeating this 10 times every hour. For your isometric quad exercise that you'll find on your physiotherapy handout, what you're going to be doing is you're going to find yourself in a supportive position with your legs straight out in front of you, and you're going to be pushing your knee down towards the table. You're going to tighten the muscles in your quad or your thigh as tightly as you can, and you want to hold it for 10 seconds. Your next exercise that you're going to be performing after surgery is your heel slide exercise. The most important thing to remember is keeping your heel in contact with whatever surface it happens to be, whether it's kitchen counter, table, floor, bed. You do not want to lift your leg up into the air. What you're going to be doing is you're going to be sliding your heel up towards your bum to the point where you feel some discomfort, and you're going to hold at that end position for about 5 seconds before sliding back to the original position. You're going to be completing this 10 times, 4 to 5 times a day. In terms of returning to your regular sport or your daily work life, you're going to be speaking to your surgeon, and they're going to assess how far you've come along in your rehabilitation and give you further guidance on how close you are to achieving your goal. Everyone is probably going to be needing to use crutches for a few weeks following their ACL surgery. Whether you're non-weight bearing or considered weight bearing is tolerated, you'll still likely need crutches for support, and it's important that you size them correctly just for your own comfort. So when you get your crutch out, what you're looking for is you're trying to set up the crutch height should be about 3 fingers from underneath your armpit. so that it rests comfortably into your rib cage. You don't want it jammed up too high underneath your armpit because you'll start to lose a sensation to your hand. So you do want it to sit into your ribs here. Once you get the height set up, your next marker is you're going to set up the handle here. So if your hands are sitting nice and casually just at your side, you want it to hit about your wrist cuff, so when you're hanging onto the handle, your elbow's in a slightly bent position. Depending on your surgical protocol you'll be following, you'll be told that you're either considered non-weight bearing or weight bearing is tolerated. For those of you that are going to be considered non-weight bearing, what that means is we don't want you to take your operated leg and have it on the ground. So you can have it resting, but you just don't want to stand flat on that or put your weight down on that side. So you're going to be using your crutches to take the weight off. So when you're going to be using your crutches, the crutches are going to be coming forward, your operated leg is going to stay relatively in between, and you're just going to be pushing your weight forward and swinging through. Okay. For those of you that are weight bearing is tolerated, likelihood is your leg won't be strong enough following your surgery to get rid of crutches right away, and you'll still likely need them for a few weeks. When your weight bearing is tolerated, what you're going to be doing is same idea as your crutches are going to be going forward, but you're going to step forward with your operated leg and taking as much pressure as you feel comfortable with through the leg and still supporting yourself with your crutches, and then you're going to step through. It's important to remember that your operated leg strength is not going to be the same as it was prior to your operation. So it's important that you support your operated leg while you're getting in and out of bed. So you're going to support it throughout that movement until you're permitted by your doctor or physiotherapist to start without.